Does your loved one have a surgical wound or surgical incision that needs management? I'm here to help you. I'm Bienstock, and I'm a board-certified plastic and reconstructive surgeon. I help patients who are homebound and bedbound. Today we're going to talk about surgical incisions and surgical wounds. This is a very complicated topic. The reason why it's complicated is each surgical wound is different. It depends what the original surgery is. Some people have heart surgery, they have hip surgery, meaning they have a hip replacement, they have plastic surgery. My experience dealing with surgical wounds is I didn't know anything about surgical wounds, and I'm a plastic surgeon. Until I started doing wound care about 8 years ago is when I became much more informed. The most important thing is why did the wound break open, or why is there a surgical wound? There's this myth that you can't shower with a surgical wound unless there's an exposed prosthesis, which means a foreign body such as a hip replacement or breast implant, which would have to come out anyway. We always recommend showering with soap and water, or sometimes using something called Hibiclens. It's okay to use an occlusive dressing. I don't recommend leaving an occlusive dressing on for a long period of time. It doesn't let it breathe. It traps moisture, as we talked about in previous sessions about keeping moisture there. It breeds bioburden, what we call bacteria. So we want to I like to change wounds on a daily basis, use very simple dressings. If you're worrying about contamination due to urine or feces, then you have to use an occlusive waterproof dressing. But most of the wounds that are surgical are in the knees or the hips. You just have to keep them clean and use a very simple dressing. You don't want if you're having drainage from the wound because it's a big open wound, like you can have a wound that's this big that opens up, then you have to pack it. What does packing mean? You have to fill the hole in. Now, if it's draining a lot, you don't want to use something that's wet because you're just adding more moisture to something that's draining. You want to dry it out. The dressings such as Hydroferro Blue, Aquacel are the alginates. The most important thing is in a surgical wound, just like other wounds we've talked about, you have to remove all the dead tissue, or what we call devitalized tissue. You want to keep it clean. If it's infected, you should be working with the surgeon in terms of appropriate antibiotic maintenance. But the key thing is just keeping it really simple, using good common sense. A lot of surgeons, when I was a surgeon, we use something called Dakin solution. This is something I only recommend if it's infected. Dakin is basically a diluted bleach solution. I wouldn't recommend bacitracin, mupirocin. These are generally not the best form of treatment for wounds that are open due to surgery. The most important thing is just keeping it clean. As I said, if it's draining, you want to absorb the drainage and use dressings that will protect it. You don't want to change it once a week. You want to generally try to change it every day or every other day. If you have any questions, you have a loved one who suffers from a specific surgical wound, please let me know below. I'm here to help. Leave your comments and make sure you subscribe to the channel. I look forward to our next episode. Thank you so much.